Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Practice this quiz on www.thestudyblog.com. Legal and ethical considerations. The best explanation of what Title Y of the Civil Rights Act mandates is the freedom to Option A. Pick any physician and insurance company despite one's income. Option B. Receive free medical benefits as needed within the county of residence. Option C. Have equal access to all health care regardless of race and religion. Option D. Have basic care with a sliding scale payment plan from all health care facilities. Right answer is Option C. Have equal access to all health care regardless of race and religion. Which statement would best explain the role of the nurse when planning care for a culturally diverse population? The nurse will plan care to Option A. Include care that is culturally congruent with the staff from predetermined criteria. Option B. Focus only on the needs of the client, ignoring the nurse's beliefs and practices. Option C. Blend the values of the nurse that are for the good of the client and minimize the client's individual values and beliefs during care. Option D. Provide care while aware of one's own bias, focusing on the client's individual needs rather than the staff's practices. Right answer is Option D. Provide care while aware of one's own bias, focusing on the client's individual needs rather than the staff's practices. Without understanding one's own beliefs and values, a bias or preconceived belief by the nurse could create an unexpected conflict or an area of neglect in the plan of care for a client, who might be expecting something totally different from the care. During assessment, values, beliefs, practices should be identified by the nurse and used as a guide to identify the choices by the nurse to meet specific needs/outcomes of that client. Therefore, identification of values. Which factor is least significant during assessment when gathering information about cultural practices? Option A. Language, timing. Option B. Touch, eye contact. Option C. Biocultural needs. Option D. Pain perception, management expectations. Right answer is Option C. Biocultural needs. Cultural practices do not influence biocultural needs because they are inborn risks that are related to a biological need and not a learned cultural belief or practice. Transcultural nursing implies Option A. Using a comparative study of cultures to understand similarities and differences across human groups to provide specific individualized care that is culturally appropriate. Option B. Working in another culture to practice nursing within their limitations. Option C. Combining all cultural beliefs into a practice that is a non-threatening approach to minimize cultural barriers for all clients' equality of care. Option D. Ignoring all cultural differences to provide the best generalized care to all clients. Right answer is Option A. Using a comparative study of cultures to understand similarities and differences across human groups to provide specific individualized care that is culturally appropriate. Transcultural care means that by understanding and learning about specific cultural practices, the nurse can integrate these practices into the plan of care for a specific individual client who has the same beliefs or practices to meet the client's needs in a holistic manner of care. What should the nurse do when planning nursing care for a client with a different cultural background? The nurse should Option A. Allow the family to provide care during the hospital stay so no rituals or customs are broken. Option B. Identify how these cultural variables affect the health problem. Option C. Speak slowly and show pictures to make sure the client always understands. Option D. Explain how the client must adapt to hospital routines to be effectively cared for while in the hospital. Right answer is Option B. Identify how these cultural variables affect the health problem. Without assessment and identification of the cultural needs, the nurse cannot begin to understand how these might influence the health problem or healthcare management. Which activity would not be expected by the nurse to meet the cultural needs of the client? Option A. Promote and support attitudes, behaviors, knowledge, and skills to respectfully meet clients' cultural needs despite the nurse's own beliefs and practices. Option B. Ensure that the interpreter understands not only the language of the client but feelings and attitudes behind cultural practices to make sure an ethical balance can be achieved. Option C. Develop structure and process for meeting cultural needs on a regular basis and means to avoid overlooking these needs with clients. Option D. Expect the family to keep an interpreter present at all times to assist in meeting the communication needs all day and night while hospitalized. Right answer is Option D. Expect the family to keep an interpreter present at all times to assist in meeting the communication needs all day and night while hospitalized. It is not the family's responsibility to assist in the communication process. Many families will leave someone to help at times. Ethical principles for professional nursing practice in a clinical setting are guided by the principles of conduct that are written as the Option A. American Nurses Association's (AIIMS) Code of Ethics. Option B. Nurse Practice Act (NPA), written by state legislation. Option C. Standards of care from experts in the practice field. Option D. Good Samaritan laws for civil guidelines. Right answer is Option A. American Nurses Association's (AIIMS) Code of Ethics. This set of ethical principles provides the professional guidelines established by the AIIMS to maintain the highest standards for ideal conduct in practice. As a profession, the AIIMS wanted to establish rules and then incorporate guidelines for accountability and responsibility of each nurse within the practice setting. A bioethical issue should be described as Option A. The physicians making all decisions of client management without getting input from the client. Option B. A research project that included treating all the white men and not treating all the black men to compare the outcomes of a specific drug therapy. Option C. The withholding of food and treatment at the request of the client in a written advance directive given before a client acquired permanent brain damage from an accident. Option D. After the client gives permission, the physicians disclosing all information to the family for their support in the management of the client. Right answer is Option B. A research project that included treating all the white men and not treating all the black men to compare the outcomes of a specific drug therapy. The ethical issue was the inequality of treatment based strictly upon racial differences. Secondly, the drug was deliberately withheld even after results showed that the drug was working to cure the disease process in the white men for many years. So after many years, when the nurse described the client as that nasty old man in 354, the nurse is exhibiting which ethical dilemma? Option A. Gender bias and ageism. Option B. HIPAA violation. Option C. Beneficence. Option D. Code of ethics violation. Right answer is Option A. Gender bias and ageism. Stereotyping an old man as nasty is a gender bias and an ageism issue. The nurse is verbalizing a negative descriptor about the client. The distribution of nurses to areas of most need in the time of a nursing shortage is an example of Option A. Utilitarianism theory. Option B. Deontological theory. Option C. Justice. Option D. Beneficence. Right answer is Option C. Justice. Justice is defined as the fairness of distribution of resources. However, guidelines for a hierarchy of needs have been established, such as with organ transplantation. Nurses are moved to areas of greatest need when shortages occur on the floors. No floor is left without staff, and another floor that had 5 staff will give up 2 to go help the floor that had no staff. Thanks for watching. You can also practice this quiz on www.thestudyblog.com, link in description box. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.